You've probably seen movies that show shocking moments in slow motion. The background fades away, and the character seems to go off into their own world. I've never been in a movie, but I had that exact experience. My moment came in February 2019, when I was sitting in my pathologist's office after he had gently prodded my neck, gathering tissue for a biopsy of a lump I found 3 months prior. He left the room, analyzed it under a microscope, came back in and gently said, "I think it's Hodgkin's." This is when my normal day turned into a scary movie. The doctor continued to talk, telling us what tests he believed would come next, and I sat there holding my husband's hand with tears slowly streaming down my face as we nodded politely trying to listen. But we realized we hadn't heard much after we realized that I might have cancer. I truly believe in divine timing, however. You see, I did not discover this lump until I had the exact tools and resources to handle it how I needed to. When I look back at pictures, I realized that this lump had been in my neck for up to 2 years prior. At least that's the earliest picture I could see. And during those 2 years, I had become a functional diagnostic nutrition practitioner. I had connected with integrative and holistic practitioners across the country, and I had learned how to support my body. In fact, over the course of those 2 years, I had really strengthened my body and built my resilience. By the time I was diagnosed, I had access to a community that could help, but not everyone does. And because of this, and because of my successful experience in treating my Hodgkin's lymphoma, I truly believe that the future of health is when conventional medicine and holistic and integrative practitioners join together to create integrative protocols and treatments for the masses. I chose to use conventional chemotherapy to treat my Hodgkin's because it has an efficacy rate of 95%. But I knew that this treatment choice would wreak havoc on my body, and I wanted to protect it. So I chose to also hire an integrative oncologist, Dr. Heather Paulson, who helped guide me through a detailed supplement regimen to protect my organs and support my body through the 3 months of treatment. This, in combination with my previous nutritional and lifestyle changes that I had already made, supported my body and helped me beat cancer. Not only am I happy to share that treatment was successful and I am over 1 year in remission, but I have seen firsthand how this unique approach has saved my body from a lifetime of long-term and painful side effects. My experience, unfortunately, is not common. And this is why I believe we need to see a change in the world of medicine. As I follow other Hodgkin's patients and survivors on social media, I see fear, I see sadness, aches, pain, early menopause, fatigue, and so much more. So I chose to start a community, one that provides hope, one that empowers Hodgkin's patients to advocate for themselves, to create a team of providers, and to choose an integrative approach to support their body through the process. I wrote the book, Healthy Through Hodgkin's, not only to share my story, but to provide hope and encouragement in an area where I really didn't find much out there. Whether it be cancer, diabetes, gut health, hormones, or heart disease, there is a time and place for conventional medicine, prescriptions, and surgeries. But we can't stop there. There is so much more that can be done to help the patient feel well. And here are 3 places we can start. Number 1, patients should be taught how to eat to lower inflammation and to support healing before, during, and after treatment. Number 2, patients should be connected to resources like Maple Tree Cancer Alliance that helps patients work out and exercise in a safe way throughout their treatment. And number 3, patients should be encouraged to create a team of providers that includes medical, nutritional, and emotional support. Integrative care can save your life in more ways than one. I believe that the future of health is when we know that this option exists, when providers set aside their egos and work together, and when patients know that advocating for themselves is not just an option, it's their right.